on the recording. Thank you so much. If there are any objections, as I've noted in the chat, please let us know so that we can work with those that have concerns with recording this session, but we would like to share it out with others because I think there's going to be great information available for people that couldn't join today. My name is Nada Shoemaker. I'm the Advocacy Partnership Manager with Voices for Healthy Kids. And my apologies that I cannot be on video as I am talking or presenting because my broadband does not allow, it disconnects me when that happens. So that is a picture, it's pretty accurate. So you know who I am. And I've been with Voices for Healthy Kids for 5 years and help lead the IEE, or Innovation, Equity, and Exploration work groups where we explore different policy areas. I would like to then thank you all for joining us today as well, and hope that if you have questions that you will put them in the chat, and we'll be reminding you of that several times during the session. I'd like now to introduce to you Susan Morin, who is going to help facilitate the session today. She is the Director of Operations for My Power People, and before joining MPP, she was an associate with the New England Division of M&R Strategic Services. Susan has an extensive operations and business management experience and has dedicated much of her career to working in the nonprofit arena, collaborating on strategic action planning, policy advocacy, and community engagement. She lives with her family in Massachusetts, and she has facilitated for us in other events before, so you might recognize her face. Susan, please go ahead and take it.
Thank you, Nada. I'm thrilled to be with everyone today. Before we hear from our presenters, I just wanted to provide a quick overview. As Nada mentioned, the webinar will be recorded, so please keep your line muted for the duration. You do not have to be on video if you do not want to be. And we will be using the chat box function throughout each presentation, so feel free to drop your questions in there. There will be an opportunity for questions and answers at the end of each presentation, and then again at the end after all three. And we are happy to share the link and a copy of the presentations with participants after. So now it's my pleasure to introduce our first presenters, Brittany Newton and Kelsey Silvio with Voices for Georgia's Children. Brittany and Kelsey?
Great, thank you. Can you all see the title page?
Yes.
Okay, just to make sure I wasn't sharing the one with all of our faces on it.
All right, good afternoon, everyone. We are excited to be here today to talk a little about our WIC work group. The Georgia Voices team facilitated this group to better understand barriers and facilitators that impact WIC utilization, particularly among historically marginalized populations, and to identify policy levers that equitably increase WIC enrollment and utilization. But before we jump into everything, we'll just quickly introduce ourselves. Again, I am Brittany Newton. I'm a senior policy analyst at Voices for Georgia's Children, and I will try to refer to us as Georgia Voices throughout, so I won't confuse anyone.
And I am Kelsey Silvio with Voices for Georgia's Children, also a policy analyst.
Perfect. Kelsey, I don't know if you advanced. Okay, there it is. So first, to give a quick overview, we will start out by talking about a little bit of background information on WIC. Then we'll discuss the structure of the work group and briefly talk about our methodology, and then roll right into highlights of our key findings and recommendations.
So WIC is a federally funded supplemental nutrition program. It's open to support women, infants, and children through supplemental food benefits, healthcare referrals, and nutrition education. There are three overarching categories when it comes to eligibility. The first is population. So pregnant, breastfeeding, and non-breastfeeding or postpartum women are eligible. Infants and children up to age 5. And individuals are considered for eligibility regardless of their US citizenship status. Income is considered at living at or below 185% of the federal poverty line, which is around $49,000 for a family of 4. And also is considered is if the individual is participating in another assistance program, which may make them automatically income eligible. And then the last category for eligibility is nutrition risk. So an applicant must be deemed nutritionally at risk, and that's done so by a healthcare professional or a trained health official. WIC participation has declined about 20% in the past 5 years, and currently only about half of the eligible individuals participate in WIC. You can see that individuals of color are overrepresented in the WIC population compared to the general population. I would like to note that the US population that we pulled does include men and older children, so it's not exactly apples to apples, but you can get a sense of what the numbers look like. With Black and Hispanic families experiencing much higher rates of poverty in the United States, they are also overrepresented in the WIC population. So it's important to note that WIC is the key program to help ensure health and nutrition for participants, but it's also really important and can be a resource to help lift families out of poverty. The purpose of our work group was to convene subject matter experts from across the country to create a policy lever around WIC, a potential recommendation for Voices campaign opportunities. And our work group was comprised of 16 individuals from 13 politically diverse states and 6 USDA regions. On the map, you'll see stars identifying which states we had representation from.
So as far as our methodology, we used the modified Delphi technique, which would allow us to create a feedback loop between the work group and our research and policy team. Basically, the standard Delphi technique is a group decision-making tool that use survey subject matter experts to inform decisions. Instead of surveying, we facilitated work group discussions that included presentations from subject matter experts. We also conducted SWOT analyses, or strengths, weaknesses, opportunities, and threats. These discussions really helped to inform and validate what we found in the literature and helped us develop our policy lever menu. The policy lever menu is basically a list of policy opportunities that we assessed over 3 impact areas. We looked at the overall impact, the impact on BIPOC communities, as well as impact on healthy eating behaviors. The work group was essential to really helping us capture the newest policies and practices that are used to increase WIC enrollment and utilization, but aren't yet present in the literature. So moving into our primary findings, our work group discussion and literature review yielded 5 overarching themes. We highlight some of the effective strategies identified within each theme, as well as talk a little bit about the barriers experienced. The findings and the recommendations are not organized by priority, but they provide an overview of the potential strategies to increase enrollment, retention, utilization, and redemption. And states can find that one or more of these strategies can really help in addressing the primary drivers to declining participation rates in WIC within their state. So I'll start off with the technology one. A number of opportunities are available to maximize technology to decrease barriers to WIC participation. Some of those barriers under enrollment and certification include online pre-applications, which once they're submitted, it'll prompt a WIC staff member to contact a potential applicant. What we found is that some have taken this a step further and added an eligibility determination tool to it, so that you're already determining eligibility right there online. Some of the agencies have also included chatbots, which will allow applicants to be able to receive immediate responses about eligibility requirements, program details, questions about the application process. But one of the things that we found is that with the chatbots, they're usually available in English. So in English only. So one of our participants was from Maine, and 50% of their WIC participation, the family speak languages other than English. So it's really important to consider this on the front end as far as applying these modifications and including multiple languages. Other tech improvements have included like a document uploader, two-way text, an applicant or patient portal, video conference software to conduct remote certification appointments. Some of the main challenges that we've seen is that tech enhancements, like I said, aren't available in multiple languages, identifying adequate technical assistance, and this can be either on the client's end or for WIC staff members, and that doing partial integration enhancements, it can sometimes lead to additional or increase in administrative burden, and continued financial support is really needed to maintain tech enhancements. Now, as far as nutrition education goes, we saw that technology is fairly common. What's used most often are like online classes and modules, remote breastfeeding to support different groups, as well as video conference sessions with a nutritionist. We saw that it was really effective for both rural communities and families with young children, because limiting the number of times that a family has to come into a WIC clinic really encourages continued participation. However, one of the main themes among the work group participants was the need to expand nutrition ed sources. A lot of them used outside sources like Kelly Mom, and found that WIC clients were very receptive to that, and being intentional about incorporating this in WIC resources would be helpful for continued engagement. And lastly, with redemption, is the WIC shopping experience is really important as far as to the WIC clients' satisfaction, continued participation, as well as purchasing of WIC food package items. Using a WIC mobile app allows participants to scan food items to determine if they're eligible for WIC purchase, which has really eased any intimidation experience by participants and minimizes negative interactions with grocery staff. And participant portals have also been helpful. In both the literature and in the work group discussions, we found that WIC apps really improve accessibility to like WIC food balances, expiration dates, as well as reporting problems related to EBT cards. Some of our work group participants have also been able to leverage apps to do push notifications and capture real-time feedback as far as satisfaction among WIC participants. So basically, our overall goal is to leverage technology to really simplify the administrative processes and improve the overall experience. So next I'll move into some of the data-driven approaches. One thing that we know is that in 1989, Congress established adjunctive eligibility, which allows families enrolled in Medicaid and SNAP to be automatically income eligible for WIC. So what states have begun to do is explore data matching processes to increase enrollment. And so essentially what a state will do is identify a program like Medicaid and develop a data sharing agreement or protocol to share contact information to contact these eligible families. And so the WIC agency will develop an outreach approach, which usually includes like two-way texting, and prompt these families and help them navigate the enrollment process. However, one of the greatest challenges is establishing this data sharing agreement, because sometimes the privacy policies don't align, and WIC staff has to figure out how to navigate those barriers. But if they're able to do that, they've seen significant gains in enrollment and have found that two-way texting has been more cost-effective than general mail outreach. Another strategy is to do spatial epidemiology or hotspot analyses, and this is becoming more popular. We found a study where they layered birth data with the WIC integrated statewide information system to identify clusters of WIC eligible women, and they determined eligibility by whether or not they were enrolled in Medicaid, and used this information to develop targeted approaches. So our overall recommendation here is to streamline WIC eligibility determinations and enrollment with other public benefit programs. So now I'll move into some of the cultural and linguistic barriers that we found. One big thing is that anti-immigrant rhetoric has had a significant impact on families applying for safety net programs. Immigrant families have had an increased fear of deportation or family separation, and this is especially common among mixed status families. Other concerns and misconceptions have been that if they, take the WIC benefits, that they risk precluding college aid, or that their US-born children could lose citizenship, or families are required to pay back the benefits. So we found that meaningful collaborations with community partners and community leaders can help secure that trust within these communities, and also expand the outreach to include community health workers. There are several funding mechanisms to help support the incorporation of community health workers in WIC. Some of those could be leveraging recent investments from the American Rescue Plan Act, pursuing Medicaid reimbursement, applying for federal demonstration waivers, as well as applying for grants, and allocating capitated payments in managed care plans. As far as making sure that the services are linguistically appropriate, it would be helpful to collaborate with agencies and organizations that serve diverse WIC eligible families, leverage culturally relevant media sources within targeted communities. So this could be websites or social media groups, developing materials that reflect the culture, ethnicity, and language of various communities, as well as promoting these materials within local establishments like laundromats, gas stations, hair salons, and so forth. And so with that, I'll toss it to Kelsey to talk a little bit about the nutrition education and utilization findings, as well as redemption.
Great. So considering culture is also really important when it comes to nutrition education. We found that diverse representation in lactation consultants proved to be really effective in encouraging women to either initiate or continue breastfeeding, especially in WIC participants of color, and also training peer counselors and WIC staff in culturally appropriate and client-centered nutrition education and breastfeeding has had some successes. In regards to redemption, it's really important that we're embracing the historical and societal context related to food traditions and the practices that they can help to improve with that WIC redemption. For example, Indigenous populations, specifically we found with Alaska Natives, that traditional foods and practices may contribute to self-worth or social prosperity. And some of those include sharing or trade or rituals, and expanding food packages to include more traditional foods, as well as broadening that nutrition education to include the preparation, processing, and storing of those traditional foods can improve access and really helps retain that participation as well. Another major finding that we had was on American Indian reservations, some Pacific Islander communities, and urban communities. There's either an insufficient availability of fruit and vegetables, or they're available, but just at a much higher cost. And so retailer incentives or vendor training can really help by including product placement or promotion, which would then increase redemption of, or could increase redemption of cash, the cash vouchers for fruit and vegetables as well. Our next finding and recommendation is around those community partners, and partnerships are a really critical piece of taking an integrated approach to improving access for utilization of WIC. Cross-agency collaboration is a key component in reaching those WIC eligible but not enrolled families. So state agencies administer several federal programs, and oftentimes they serve families that meet eligibility criteria for more than one program. So MOUs or data sharing agreements are an opportunity to collaborate with those other agencies, but also, like Brittany said, they can help streamline that process and reduce the administrative burden. Another opportunity amongst agencies would be identifying common goals. So for example, Medicaid recently came out with a pretty big push to address social determinants of health, and food insecurity is one of those social determinants of health. So that would be an opportunity to align with the WIC and Medicaid administrations to really support some mutual goals that they have for WIC. Possibly that could be prioritizing the peer support in a state plan, or requiring those managed care organizations for Medicaid to contract with those community health workers. Another strategy for that collaboration could be partnering with community organizations in clinical settings, such as a hospital or federally qualified clinic, and really leveraging those trusted relationships and gatekeepers in the community to help support that enrollment. In regards to enrollment and redemption, co-location strategies can also support addressing some barriers for non-participating families. They help address the limited operating hours for a WIC clinic or possible access to transportation. One work group participant shared that they were familiar with a WIC office located in a Kmart, which is an obvious convenient location when it comes to grocery shopping. And once we got into discussion in our work group, it's important to note that we started looking into possible administrative barriers, and if an entity is hosting a possible WIC clinic, is that entity allowed to accept WIC benefits? So there's a few things that may need to be explored whenever it comes to co-location opportunities, but it really could reduce the barriers for those potential clients. And then a final example would be the collaboration between Head Start and WIC. They have the population and also the income eligibility. They serve a very similar audience. And so WIC has a farmers market nutrition program, and the collaboration among Head Start and that possible program could help increase access to the fruits and vegetables, which is beneficial for the families to be engaged with WIC and to be engaged with the nutritious food, but also can support the economy and farmers as well. And our final recommendation was to have a thoughtful evaluation of the COVID-19 flexibilities. Some of those waivers included waiving physical presence requirements, issuing benefits remotely, issuing up to 4 months of benefits, or providing flexibility in a food package. So states across the country participated in WIC waivers in various ways, and many had to determine how to leverage those different flexibilities to address the COVID-related food shortages. So there's definitely a research opportunity to understand what that implementation looked like and possibly what policy recommendations we can really glean from that. Lastly, we would just really like to thank Voices for Healthy Kids, the American Heart Association, and Robert Wood Johnson Foundation for funding this work. It was extremely beneficial to our state, and we believe to the work group members, and we hope to all of you. So that concludes our presentation, and I will stop sharing and leave it open for questions.
Thank you, Brittany and Kelsey. We'll pause for a moment to see if any questions come in. I don't believe any were populated during the presentation, but there'll be an opportunity at the end as well. All right. Now let's welcome Jennifer Cadenhead and Pam Koch with the Lori Tisch Center for Food Education and Policy. Jen and Pam.
Hi, everyone. And I'm Pam, and Jen is here too. And Jen has lost her voice. And so I will be doing a lot of the talking today with the presentation that Jen actually put together. So let me share my screen so you'll all be able to see the slides. Desktop one, okay. Okay, you can see my slides, right? Yes?
Yes.
Okay, perfect, thank you. So our project, our Innovation, Equity, and Exploration project was to move towards healthy school meals for all, understanding the barriers and facilitators, getting it to be implemented, and then once it's implemented, making sure it is working, which means that kids are taking and eating the food. And so as you just saw before, we are Jen and Pam, and I also want to acknowledge that two of our other team members, Leslie Krupa and Julia McCarthy, also worked a lot on this project. At the Tisch Food Center, we conduct research on food and nutrition education practice and policy, and we translate that research into resources for educators, policymakers, and advocates to give people the power to demand healthy, just, and sustainable food. So very similar to the last presentation, we will be talking about the work group that we put together, what our findings are, and then some parting thoughts. So to start with the work group, the background, goals and objectives, and the members that we had in our work group. And before we get to that, I just want to talk a little bit about why free meals for all children is really important. In 2019, 10 million children faced hunger. This increased to 12 million children as the COVID-19 pandemic started. In 2019, 30 million children received free or low-cost meals through the National School Lunch or Breakfast Program. And food insecure or marginally secure children, up to a third of their calories and nearly half of their nutrients of concern come from the National School Lunch Program. Children who are marginally food secure and sometimes even food insecure may be unable to receive free or reduced priced meals. During COVID-19, 100,000 schools essentially offered free school meals for all. Improved access to these meals has been made available through the Community Eligibility Provision Act and the Healthy School Meals for All. The American Heart Association's policy paper has endorsed both of these efforts. So the goals that we had for the work group is to create a diverse group of food service directors, researchers, and advocates who had experience implementing or interested in implementing healthy meals for all students policies. We wanted to really get the people who are actually doing this work and are the food service directors really talking to each other to figure out how we could make this work. We wanted to identify and fill research gaps that were related to CEP and HSMFA, and then develop tools through a case study, advocacy materials, and media policies that advocates could use to persuade decision makers in collaborations with Voices for Healthy Kids, and provide policy recommendations and final reports around CEP and HSMFA issues for Voices for Healthy Kids internal consideration. So when we were putting together the working group, we wanted the membership to meet one or more of the criteria that are listed here. So oversee or support CEP implementation, had expertise in CEP policies and or practices, demonstrated a track record of supporting policies, and had membership in another group directly impacted by school meals. The activities were to work collaboratively, to attend monthly meetings that were held throughout the whole process each month, and contribute to perspectives, to share information, evidence, and resources, and develop and provide feedback on recommendations. And so I'm going to put up the list of all of the different organizations and not read through them that were members of the work group or guests in the work group. And you can see it was a very wide range of organizations. And now I will move on to the findings. And first, I want to talk about the benefits of healthy free meals for all students. First, there's emotional benefits. It reduces student stigma. There can be a stigma that students, even if they are hungry, may not want to take the school meals for fear of then having people think that they need food or are a poor student. It also eliminates the stress of collecting meal debt, and that stress is on this, the decreased stress is on both the students as well as the school staff. And it's stress on the school staff knowing that students may not be able to actually pay the debts, as well as just everything it takes to do that. And it eliminates the need for alternative meals or refusing to give a meal to a student who is coming and asking for a meal and saying that they can't have a meal because they haven't been shown that they actually would qualify for getting that meal for free. It also is equity promotion. So it promotes health equity across the population because it just equalizes access to healthy school meals for all children. It eliminates hunger of children who don't want to eat because they don't want to be seen as taking a meal because they may be seen as that they need it or they're too poor to get food in any other way. It improves diet quality. And there's many research studies that show that students who eat school lunch actually have healthier diets overall. It improves outcomes of those who are marginally food insecure, and it assists those unaware of their eligibility. There's many people that may not be aware that they are even eligible for this program. And just like the Voices Georgia group talked about, is there are many people that fear being involved in any government program because of their immigration status. So to move on to other benefits is it has administrative ease. It eliminates paperwork of collecting meal debt. It's easier administrative review because you just have to count how many meals you have given out. You don't have to worry about categorizing students as who had to pay, who was reduced, who was free. And it's improvement in the financial outcomes for the schools. And this has been shown in many places that it actually ends up being an improvement to the finances of the schools. The student outcomes, they have more time to eat the meals. When you're just giving out the meals to everybody, you can make the line go faster because you're not worried about checking in and counting each student. Of course, how many meals are given out still needs to be counted, but it's much easier to just count the meals. There is less time with school nurses because students are eating. Students can be better focused in class. There can be fewer behavioral issues, and it can also lead to improved academic outcomes. Now, there's also barriers that were found from the work group that were related to implementing free meals for all. First are emotional barriers. There can be a fear of ongoing cost associated with paying for meals, uncertainty if there's actually going to be benefits, and not enough engagement. Any of us who have ever worked in schools have realized that it is very often that school meals are separate from a lot of other activities and programs that go on in schools. And so people may not be engaged in realizing the important role that school meals play for all students to eat, and particularly for students who are food insecure or marginally food insecure. So there also is some myths and then facts. There's the relationship between using the community eligibility provision and Title I funding. There are many people that fear that they may lose their Title I funding if they participate in this, and that is not true. So schools will not lose their Title I funding by participating, and there are ways to work around that, even if they felt like the only way they could justify their Title I funding was through having people fill out the eligibility for the free meals. The others is that the requirement difficulties in getting involved in the program. There is not enough research that shows the benefits, or not, and also not enough communication about the research that has been done. And then there's eligibility difficulties. And so now, what are the facilitators? What can help to make this happen? First is really understanding your political and budget cycles. Very often there may be a politician who is up for re-election, and actually that politician's constituents would be very excited to have free meals for all students. And so if that politician is advocating for it, it can actually be helpful. Also understanding the budget cycles and how figuring out if you will need some local funding to help to support it and when that can be put in, and having the local politicians understand the benefits. Additionally, a facilitator is how much COVID has shown everyone the spotlight on hunger. And I'm sure everyone, no matter if they are in the field of food and nutrition or otherwise, can remember all of the news coverage that there was about people on lines waiting for meals from food pantries, from all the school meals that were being given out in communities across our country. Next is that school meals are Americans' healthiest meals. School meals have very strong nutrition standards. They have always had nutrition standards, and those nutrition standards were increased with the Healthy Hunger Free Kids Act of 2010, which was the last time that we had child nutrition reauthorized. And because of that, they are the healthiest meals, which the rest of our food supply does not have nutrition standards, and we know what the rest of our food supply is. And so that can be very helpful. The other is that there is a lot of nutrition education that is going on in schools. And when we see that nutrition education paired with getting students to eat the school meals, the synergy of making the most of the government school meals program is really, really terrific. There's also cost savings and increased revenue for the school administration because of increased participation of school meals and economies of scale. If you are producing more meals, you are going to be able to get better prices on the food, so you are maybe lowering your food costs. And overall, though, the increased participation that has been found to happen when schools and offer meals for free ends up making up a lot of the difference of what is being paid for. And there's what's called direct certification, which means students that are just directly certified to be part of the meal program because they are a part of another government program. And so using that or careful tracking can be a boost to get to the criteria to be able to get CEP or another way to get free meals for all students. There can also be ways that what can also facilitate it is making connections. So understanding the concerns of all different stakeholders in the community can help to make connections. It can connect, we can connect with students when we can also work on making the cafeteria environment more appealing. That can actually help the students to want to eat more. It can be making the cafeteria environment more physically appealing. We in New York City have been doing some cafeteria redesigns in the middle schools and high schools that change the seating in the cafeteria and just redesign the look of the cafeteria and the serving line. And it has gone a very long way to increase students' attitudes towards school meals. There's also other ways to figure out ways to get students in and through the line faster and make the eating a more pleasant time that actually can help the students to want to eat more of the food that is being offered. There is also ways to connect to the family and community and to connect it to student achievement and to wellness and all those bread and butter issues that the schools really care about, which is having the students have really high well-being, connecting it to mental health, that basically students who eat well will be able to deal with any mental health issues that they are having. And then education to local farmers, the food service line, and other employees and healthcare providers and others outside of the school, that everything can be connected will help to build those benefits. And so here are some trends to implementing HSMFA. And first of all, there are 2 states that are currently enacting free meals for all students. That is California, and California had a huge number of advocates working on this. They actually had over 200 advocacy groups working on this. And Maine was able to pass this as well. And I think it was because of the highlighting of all of the hunger from the pandemic that helped to push it through. Vermont has been very close, and many other states are considering this. It is also being looked at in the federal level with many of the recovery programs that are being put into place. So the budget reconciliation, it could come in through Build Back Better. And also we will be looking to the country will be looking to do child nutrition reauthorization again soon. And it could be considered to be in that as well. And I believe if we keep advocating for free meals for all, that we will be able to have that happen. And so here now are some parting thoughts. So some of the key takeaways are that we need advocacy groups to be pushing for free school meals for all. And those advocacy groups have needs. They have financial and technical needs to support an effective broad coalition. So if we can get through foundation funding or through other funding, more support for the lead advocacy groups in a state or a region or a city that are pushing to make sure they can get free meals, That will give them the support they need to get to those multiple stakeholders. They also need financial and technical support for marketing campaigns. Marketing campaigns have been very effective. In New York City, which has had community eligibility provisions since 2017, there was a wonderful marketing campaign about what free meals meant to students and them holding up signs in social media and all of that. So if groups can have that kind of financial and technical support to do good marketing strategies, that can build the stakeholder support and basically build engagement across all different groups. And then we need research to support targeting messages locally, that each community that is working on this will have some common messages and also some messages that would be unique to what they are doing, and to find those out so that those can be part of the strategy. And then school district needs. They need support to interpret existing opportunities and regulations so that they can understand that they will not lose other funding and actually potentially could gain funding as well as gain all of those benefits for students. They need connection to advocacy groups to strategize campaign approaches, and they need to engage all stakeholders. Also, we need ultimate policy levers are needed to do this. So we need to replace the community eligibility provision with the healthy school meals for all. And we want to ensure that HSMFA applies to all federal nutrition programs, including CACFP, as well as summer seamless option and other programs. We want to ensure that the free status for all K-12 students is in effect for both the school year and for summer programs. Ensure that any student, regardless of age, who is enrolled in K-12 educational institutions is eligible for free meals. And it also must include pre-K, Head Start, and early Head Start. And so I also want to talk about some additional research needs. And so we need to understand, what are the financial levers in states for HSMFA, and how does the source of the funding for school meals impact the eligibility to pass this legislation? What are the total costs incurred in processing school meal applications? If we could better understand all of the time and effort that was put into processing all of the applications and what would be saved by not having those because we just had free meals for all students, that could be a good point for advocating for this. For schools that have implemented HSMFA or have 100% CEP, what are the factors that impact participation rates? What methods are most efficient and accurate for measuring student poverty in lieu of school meal applications? I think understanding that is really important too. It would also go a long way of many people in education, even if they have nothing to do with school meals, will talk about schools related to the percentage of students that qualify for free meals. Every single time that is said, it is reinforcing that school meals is a poverty program that just happens to be operating in schools. When we can find these other methods of measuring poverty, which of course continues to be important, we could go a long way to extending having the meal program be just part of the school day. I want to share some resources, and so you may want to either snap a photo of this, or as was said before by Susan, these slides will be shared. And finally, we want to acknowledge and thank the support from Voices for Healthy Kids, which is an initiative of the American Heart Association and the Robert Wood Johnson Foundation for funding this work. Thank you.
Thank you, Pam. A few questions did come in, and Jen and Kelsey answered them along the way, but Nada is going to share some of the other ones with you.
We did have some questions that did come in. Thank you so much. And as she said, Jen did answer most of them. I wanted to address, Danielle asked, how can we improve the school meal experience, quality of food, quantity of food, and variety provided? And most of the complaints that are received are related to one of these issues. And I know that you're having a throat issue, so she has responded, so I'm going to share that response with you for those of you who can't see the chat. Sometimes that depends on local wellness policy, as well as funding support for schools. Wellness policies can specify what types of food are served, and funding can ensure proper supervision for consistent service, as well as ensuring that the environment is pleasing. And y'all, do you have any additional comment or question related to that response?
Yeah, well, the reason that I asked, we were I'm in Indiana, so sorry. Let me turn my camera on. Oh, okay. I'm from Indiana. We were one of the first states that passed better nutritional choices. We had a huge coalition working on this issue. And of course, we wanted to move forward with other school policies. But we've lost some members because they said, the school cafeteria experience is not the same. The children, youth, I don't want to just say children, youth are not eating the lunches. They're throwing away quite a bit of the food. And so I've been concerned about approaching this policy in Indiana because one, I know is going to be positioned as you want to lower the quality of the food that's offered to all students because we're paying for all students, and especially poor students. These lawmakers have some warped thinking. And so I've just been concerned that we will get more people pushing back because we do have a number of, school personnel that have talked about how much food that has been thrown away since we changed a number of these policies. So that's my biggest concern with approaching this issue, because I think we have to work on the student school cafeteria experience as well as address this policy.
Yeah, I mean, I would just say I agree completely, and have spent mostly in New York City, but a lot of time in school cafeterias around the country as well. And there can be really different experiences that students have. I think that the cafeteria redesign, which, like I said, was middle and high schools in New York City, that changed to a choice-based serving line, as well as then gave a variety of seating options. Research that we have done that was funded by Robert Wood Johnson Foundation actually showed that it increased participation a lot. I think it was from 20% to 40%, which is typical for high school participation to be that low, and also improve the students' attitudes towards school lunch pretty tremendously, which is amazing that you can do that. So I think working on the cafeteria environment is really, really very, very important. And making sure that what's called the offer versus serve, which is the students are getting the meal components that they want. So hopefully what they get on the tray is what they are going to eat. I do also think, and I understand where your politicians are coming from, but I do also think that offering free meals to all students doesn't mean that then the quality of the food will go down for everyone. And again, I know I'm speaking to the choir here, but I do think that we can both improve the quality as well as make it a free program for all students.
Okay.
Thank you both so much.
Good luck. Yeah,
And can I just add a little bit? Just that what was in the presentation was also that connection is very important. That includes student participation in what they want to eat. And having appropriate choices available for the kids. So we had a member who introduced his chef, who was actually providing food that from recipes like from their grandmother, and was very good imitation of that food that they were getting at home. And also having just proper supervision can really improve the experience in general, and actually quality of the food might actually go up, because if programs participate in multiple USDA programs, they can get a discount in the food that they're purchasing. So it's more opportunities.
Thank you. I appreciate that.
I really we also had a question, another question for Jen and Pam. I also want to note there was a question from Kent Mitchell to Voices for Georgia's Children around WIC. It is in the chat. It's because I kind of need to move us along, but if you might take a chance to look at that, it's around the 3:39 p.m. Area, so you might want to take a look at that, and we can certainly address that again after Kent's presentation as well. Anna Alicia also mentioned she was interested in learning more about the role of introducing healthy school meals for all can influence opportunities to discuss equitable, value-based procurement practices and strategies to hopefully support a healthier food system more broadly. Jen, I believe that's what your response was to that, was underneath that, where she indicated that's one of the work group's findings as well. The magnitude of school meals really does impact equity, and the USDA provides incentives for good manufacturing practices. Jen, did you have anything you wanted to elaborate on that, if you want to or can?
And just the good manufacturing process is meant to promote, I guess, equity throughout the system, and also buying things locally. So, you know, they really are trying to work on that.
Yeah, thank you so much. Susan, want to go back to you?
Yes, thank you. Thank you, Pam and Jen. That was great. So our final presentation today is with Kent Mitchell from the National Head Start Association. So Kent, I will hand it off to you.
Great, thanks so much. It's been great to hear from the other groups and excited to present on our IE today. So I'm going to go ahead and share screen as well, since we have our own slides to share. Wonderful. Just make sure I pull that up. Great. So I'm with the National Head Start Association. I'm going to make a little bit of assumption that a lot of folks know what Head Start is, but just as background, and I'll put a link in the chat if you want to explore more. Head Start has been around since 1965. It was started during the War on Poverty, but also during the Civil Rights Movement. And is very much an intervention to help families who are living in poverty, children and families prenatal to 5, succeed in school, succeed in life, and strengthen families. Huge equity component to it. It's a whole child, whole family model, and very holistic. So I will go ahead and put in the chat a link if you just want to see some stats about the whole child, whole family model and what Head Start does. We were really honored to be part of this because while Head Start's well studied, it was an opportunity for us to revisit and renew our understanding of what barriers keep eligible families from accessing Head Start and early Head Start. So to revisit that, but also to bring a really intersectional lens and look at race, ethnicity, disability, and other issues and how those are intersected with access to Head Start and early Head Start. Just by way of context, again, for those who don't know, Head Start serves very vulnerable and low-income populations, so eligibility is a big issue. And I think really relevant for this conversation, Head Start is federal to local. And so it really essentially bypasses state government. There were reasons for that during the Civil Rights Movement. And that structure has persisted. And that is one of the powerful things about Head Start. It's got a national framework, but it's locally driven, locally designed. So I just wanted to share that. So as we're talking about barriers, I kind of wanted to bring this to life for folks. This is Galena. Galena White is a former early Head Start parent in Washington State. And I like to tell or lead with her story because she herself is autistic, mother of 2 in Seattle, signed up for early Head Start when she was pregnant. She had a lot of fears as a parent, as an autistic parent, that people would think she wasn't taking care of her children, wasn't capable, even people might or systems might take away her children. So early Head Start gave her the skills, confidence, and support network to really support her children, but also to support herself, her medical treatments and interventions, and to start a small business. This is a classic early Head Start success story. But the question is, what if? What if Galena had not found her way to Head Start and early Head Start? What barriers could have gotten in her way? Many could have gotten in her way. And they do for many, many, many families who are eligible. So that's what we're here to explore, making sure that people like Galena can access, and her family can access, these kinds of amazing supports that Head Start and early Head Start offer. I won't go deeply into our methodology, but just to highlight 3 of the key things. We did a national survey of the Head Start community. Head Start's a very large community. We got 2,300 responses and thousands of open-ended comments. We did a deep dive into 4 states, working with Voices for Healthy Kids to select those states, 3 southern states and New Mexico. And also we did like others on this group, we had an IEE work group, which was national, state, and parent stakeholders who met 8 times and really helped us iteratively to design data collection and also interpret it and look at it. As everyone, I just want to say our great thanks to Robert Wood Johnson, Voices for Healthy Kids, and the American Heart Association for this great opportunity. So I want to dig right into the areas that we looked at. We really broke down barriers and probed those barriers to access for eligible families in 3 areas: programmatic, administrative, and perception. And so just to give a little color there, right, programmatic would be something like, what are the hours of service that these early childhood programs offer through Head Start? Administrative would be things like the burden of proving eligibility. There's quite a bit of paperwork to prove you're on low income or your child is otherwise at risk and qualifies. And then perception, right? So what are the perceptions or biases conceptually that, you know, stakeholders who would be eligible might have? For example, that state pre-K is in school, so it's better because Head Start's community-based and maybe not as good. So really digging into those things and trying to understand those barriers. The Head Start community, what we learned, has a lot of unanimity, right, about what those barriers are. We really learned that through this project. We also learned the intensity of their views. So within respect to programmatic barriers, really almost identical intensity of responses across what we call program leadership, people who run programs, and then frontline staff like teachers or family service workers. And 3 areas really rose to the top in particular: transportation and the location of facilities. If you can't get to a program, or now a program exists in a gentrified area where there isn't a lot of people who qualify, that's a big issue. Transportation's expensive, it's hard to staff. And so that was a number one barrier to access. Family instability and unstable housing status were the other top 2, really recognizing that the population that Head Start, early Head Start serves has a lot of instability economically, socially, et cetera. And housing status can be very unstable too, as the economy goes up and down and their own personal fortunes go up and down. So those are really big issues that rose to the top in terms of barriers that keep eligible families away. One here we're going to dig into later is income eligibility itself, and some of the discriminatory nature of Head Start's own income eligibility. Administrative barriers, you'll see the intensity here was a lot less. They were considered less significant. That said, 2 to 3 really rose to the top. Lack of stable communication. If a Head Start program finds a parent who has a need in the spring, and they reach out to them in the summer, and then as the school date approaches in August or September, they may not be able to reach that family anymore. The cell phone may be turned off. There may be other kinds of communication challenges there. Paperwork and proving eligibility. Again, you have to prove your eligibility for Head Start. We'll talk more about that and people's views on that. And being waitlisted. And you'll see in a moment that parents we surveyed were clear on this too. You know, it can be hard to get into Head Start, early Head Start, because there isn't enough funding to serve all the eligible children. This really varies by location and city or town or what have you. So it's not a uniform issue, but for many parents and many eligible families, it is an issue that they are waitlisted and they don't get into the program. Some of the perception barriers we discovered, really 2 that were most intense, far and away above the others. One, that parents believe pre-K in schools is better for their child. There's just kind of a bias toward being in the school setting. I will say Head Start is offered in school settings in many cases, but roughly 80% is offered in community-based settings. And the other is just lack of awareness that people don't know what the Head Start model is. They don't know early Head Start, for example, provides free diapers. They don't know that the model engages families and helps them find job training or jobs themselves. So they don't know a lot about the model. And so the selection is kind of biased because they're not aware of the program or what it does. For parents, again, I wanted to stress being waitlisted was a big issue. Transportation and proving eligibility. And then we did ask parents, well, once you got in, did you have concerns? And these will factor into some of the barriers we know later, which is teacher turnover is very high in Head Start. Obviously, if you're a parent, you don't want to see that in your program. You want to see continuity of care. You want to see qualified staff stay. You don't want to see them leave. And of course, transportation is an issue even when they're in the program, right? Car might break down, bus doesn't come on time, what have you, right? Or Head Start program discontinues transportation. So this is the views of some parents that we sampled, and I think is very representative nationally as well. We asked them about perceptions of barriers for other families, and they said families don't aware because again they don't enroll because they're not aware, not enough hours to support working families. There's stigma involved, and they suggested offering longer hours and raising awareness, right? Were some of the key strategies programs could use. So this is just kind of the snapshot slide of the 7 barriers to access for eligible Head Start and early Head Start families that really rose to the top. So again, geolocation and a lack of transportation, low income eligibility limits, a lack of overall supply. Again, Head Start is not an entitlement, so there isn't enough funding to go around. That's especially true for infant and toddler care. Anybody on the call who's ever tried to find high quality infant and toddler care knows it's so scarce. Same is true for early Head Start. Inadequate hours of service, not covering the 10 hours, maybe it's a 6-hour coverage, which it doesn't work for working families. A range of workforce issues, teacher turnover, as mentioned, diversity of staff, lack of parent awareness, and a mix of socioeconomic issues like housing instability. I'm just going to go into a couple of these. Yeah, I think just a few of them. Geolocation issue, and you'll see some of the good quotes from folks here. I really tried to use their own words in an upcoming report that we're doing and in the report to the Voices for Healthy Kids, because I learned so much from their own words. So folks talk about how the demographics, right, have changed drastically in 10 years. No one in our geographical area is income eligible any longer. And you'll see in that bottom quote, a respondent saying, well, now that universal pre-K is being offered, families may choose to go to schools because transportation is offered. We can't afford to offer transportation. So, there's a lot of issues around the location of these programs and transportation. On the workforce issue, it really comes down to Head Start does not pay enough, right, for the qualifications and for the outcomes that the workforce generates around child development, growth, and family support. So higher wages are needed and more bilingual staff in particular. This was a very common theme that I think roughly 40% of kids served in Head Start and early Head Start are their family's primary language is Spanish. And there's a whole range of other languages, of course, in the households of Head Start families. So really noting that the field, not uniformly, but in many pockets, feels like they have a lack of linguistic and cultural competency. They do a lot to address that, but it's certainly an issue. And that issue creates barriers to access as families feel less welcome or they feel like the services don't meet their needs. Finally, just keying in on those socioeconomic issues. I listed a range of them that were common here, but folks mentioned housing, they mentioned mental health services, they mentioned the lack of transportation, they even mentioned policies on bail and sentencing. They mentioned the need to really empower parents to work with those parents to build them up, and that's the most sustainable solution to a lot of these. But that mix of socioeconomic issues is a major barrier to access for eligible families. Again, thanks to this project, we got to go deeper, right, and looked at the impact of bias, prejudice, and discrimination. So I want to share at a very high level some of those quotes and findings here. I want to stress that most programs that we surveyed, again, the 2,300, are really feel very solid, right, about the Head Start model and how they implement it and how they try to work to address community needs and family needs. And so this quote, frankly, was very representative, and I'll just read the bulleted part. I believe the reputation of our program is one of acceptance of all, and families wish to enroll due to that, right? So programs are very proud of the work that they do. And a lot of folks mentioned, hey, just statistically, they even showed me their data and their demographics, right, in the survey. We enroll a higher level of people of color. We do a great job reaching this population. So a general belief that they are able to address fairness and equity issues. That said, there was a strong analysis, kind of intersectional of income and race and Head Start structure and funding. And this quote, frankly, is one that really has stuck in my head for months now, which is, we need to focus on education and supporting families and not be in the business of making families prove how poor they are. Well put. I mean, I think that's really part of the crux of this is the income eligibility guidelines are very low in Head Start, and we're putting the burden of proof on these families who have clearly demonstrated need. And there's a lot of dynamics there to attend to. We are not given the funding to pay our employees a living wage, which is a tactic to keep poor and minority people poor. I think there's no doubt that wages and compensation are low in early childhood, in part because of the gender and racial dynamic makeup of the staff. And so that is something that folks really brought to the forefront. And then finally, there's kind of this notion that if you're federally funded, you're low quality. And this is something Head Start faces a lot. Thanks to Voices, again, we did a deep dive in a range of states, including 3 states in the Deep South. And there's some really compelling focus group data and other things there. I'll just read the bolded part here. Head Start programs have the stigma in some ethnic communities, especially in the South, that only the poor and the Black attend there. So even if you are poor and white, you do not register to attend. They go on to talk about the informal economy supports or non-governmental supports that Caucasian families may have that minority families may not have in these states. And I don't pull this out because it's not representative. It is representative of what we learned in those focus groups and very consistent. Head Start really was started in Mississippi, and it was really, again, part of the civil rights movement. And there's just a lot of these dynamics continue to show up in the communities where Head Start and early Head Start operate. Housing discrimination. I think everyone on the call understands the longstanding nature of those divides and the racism and the historical nature of those. So folks mentioned redlining and housing practices and the results of those. And I think the last quote's really good. We experienced the results of 1930s redlining still in vulnerable communities that experience socioeconomic, institutional, health, and racial inequalities. So for me, I've been with Head Start here nationally for about 3 years. This was the first time that housing discrimination really rose on the radar for me in my state-based work. We also dug into a little bit, and I'll try to move quickly to stay on time here, about perceptions of programs. Are they serving a racially and ethnic diversity of the eligible population in their community? And you'll see here there's a divide between leadership and frontline staff. Frontline staff are far less optimistic or sanguine about, that are they doing that? They are more pessimistic, right? They see bigger disparities there. So the frontline staff, perhaps not surprisingly, see, maybe we're not doing as good a job of that. They also see a lack of racial and ethnic matching between staff and children. So basically this question about the racial and ethnic diversity of the staff reflecting that of the eligible population. While 43%, okay, that's pretty good for their somewhat 29%. But when a quarter of the respondents are saying not particularly, not at all, certainly there are dynamics and issues, real issues to attend there that affect access and create a barrier to access. We did key in and ask them about various race, ethnicity, underserved populations. And the top were none. Again, a lot of our community said, nope, we do a great job. But Asian was the demographic that rose to the top both for leadership and frontline staff. Really a lot of quotes there reflecting they may not have the trust or the understanding of how to serve many Asian families, may not have the linguistic abilities, et cetera. So really keying in on that as a growth area for Head Start and understanding there's more work to do there. Income limits, I've mentioned before, are very low in Head Start. Our community is really clear. About 3/4 respondents said, if you raise income limits, you will increase diversity. You'll do that in a number of ways. You'll get more 2-earner families, economically mobile families, Hispanic families, families who work in factories or plants like meat packing industry, small business owners, and children of Head Start staff who often make very low wages, but make too much to qualify for Head Start. And so they can't even access their children, the benefits of the program. So there's very compelling reasons based on diversity, inclusion, et cetera, to raise income limits. So what's next? Programs know how to work with families. I won't go into all the options here. Programs really feel like, hey, it's all about connecting with families. It's about running a quality program, having strong and safe, strong partnerships and safe environments. These are things that we can do to reduce barriers to access. And many programs are focused on diversity, equity, inclusion, and belonging. And we're able to substantiate, all the ways they do that structurally and programmatically to remove barriers to access. Federal policy is key here. We really need more funding, right, for early Head Start. In particular, we need quality improvement funding in our field. That is very flexible funding to go toward staff compensation, transportation. Programs get to use that at their discretion within a range of 7 or 8, I think it is, categories, required state pre-K collaboration. And first and foremost, we need to pay our staff better. So there's $15 million in the Build Back Better bill. That is obviously up in the air right now, but we're hopeful it will pass and finally address some of these structural issues around compensation and the huge gap we are facing there. Because I'm state policy guy, also like state policy is extremely critical. I won't go into all of these, but there's really 3 areas where states can invest and support this and reduce barriers. One is funding, naturally, a range of funding options, programmatic work to really build in the Head Start model and some of the supports that folks need to break down barriers. And then early Head Start. There's just a lack of infant and toddler care. And we need to reach into communities through family child care to more diverse populations and diverse communities. And so there's a lot that can be done. States can play a critically important role in this work. So I think that wraps my presentation. Again, I just want to thank Voices for Healthy Kids, American Heart Association, Robert Wood Johnson, because this was a really unique opportunity for our community to go very, very deep. And we're going to continue to push this out and push for legislation and funding that reduces barriers to access so all eligible families can find their way to Head Start, which can be such a game changer for them. So thank you.
Thank you, Kent. We'll just pause for a moment and see if we have any questions pop up. And as we're waiting, I just wanted to thank everyone for joining us today, and especially thank our speakers. We appreciate all the hard work and thoughtfulness that goes into your presentations. So Nada, I'm not sure if you have any closing comments or questions have popped in.
No, I haven't seen any additional questions, and we will again be sharing the slide decks, as she said, with you after this. Give us a minute to put everything together so that we can send it out to the participants. I want to also thank everybody who did this work, who led the work with their work groups, and then put such great expertise together to share with us. And I think one of the things is the IEE groups are only about 3 years in, and they have changed and evolved over time. And I really appreciate the work that is so focused now that really helps us look at the issues that are relevant and current, and trying to find solutions or areas that can help improve what we're doing in our work. If you have any additional questions or have any thoughts that you want us to share with somebody else, let me know. Please email me. My email is on this last this slide. I'm happy to send messages along, or happy to send you and connect you to one of the IEE leads. Susan, thank you also so much for facilitating, and to everybody who joined us today. Thank you.
Thank you.